Have you ever looked at old pictures of yourself from times when you were a child? Some people would not be able to recognize you. How does a face grow? It is important for orthodontists to know how it works, and it's definitely not as simple, not just like inflating a balloon. How does a face grow? In this video, I will explain the most important facts. Have you ever looked at old pictures of yourself from times when you were a child? Some people would not be able to recognize you. And here too, in a master class in pediatric dentistry, we took a closer look at pictures of the participants taken in their childhood, when the topic of the lecture was about the growth of the face. And how does a face grow? It is important for orthodontists to know how it works. The entire body undergoes impressive changes in the proportions of the different parts of the body. Think about the babies. Their head is still quite big and the legs are still quite short. That changes quickly. The arms and legs are getting longer and longer, and what all babies can easily do, namely put their feet in their mouths. So I can no longer do that. Especially with small children, it becomes clear how quickly and how differently the face is growing. If you take a look at the faces of my two granddaughters in comparison, then you can see the older one on the picture on the right. She is 4 years old, and the smaller one on the left, she is 7 months old. You will immediately notice clear differences in the vertical structure of the face, which I can easily highlight with these reference lines. Let us take the eyebrows as the first reference, and then you will align the faces that way, and we see the second line, in the older one, on the right, it intersects with the tip of the nose, while the tip of the nose on the smaller one, on the left, is still clearly above it. And where the bottom line just touches the chin of the younger one on the left, the line runs through the lower lip of my older granddaughter on the right. And as you see, the vertical changes are quite clear here. And in any case, it is not just like inflating a balloon, and the face does not grow that evenly. There are some parts that stay at the same size all the time, like the eye sockets here. You can see that in this series of anatomical skulls. In the skull on the far left, the eye socket is just as large before birth as in the baby, school child, and in the adult. But underneath, that means under the eye sockets, the face is growing particularly much. In this area of growth, orthodontics and craniofacial orthopedics takes place, in height, in width, and in length. If you mark the skull in color, when we stain the skull, then it becomes obvious what an impressive growth the facial skull undergoes in its height and width and in length. And the question is, how exactly do we grow now? We know that trees have such typical annual growth rings, but the question is, how does the bones of the face do that? The shapes and proportions are a bit more complicated, aren't they? I can sketch it here for you on the blackboard if you want, and you can also draw together with me on a paper. So let's take the mandible, just this very simple one without any teeth, just a shape. And if you let it grow, it grows just layer by layer, and you see immediately how it loses its shape. And the same is true for any other simple bone, let's say the typical one like this one here. And if you just let it grow layer by layer, you also see very quickly how it loses its shape. So that's not the way how it goes. As you see, if we just draw such increments layer by layer, then the shape of the bone is completely lost. So how does the face grow instead? The anatomist and orthodontist Donald Enlow was able to explain how it works. Here on the left, we see Donald Enlow, who once visited me many years ago. And in the picture on the right, you can see one of his most famous graphics. So how did he come up with it? He saw that the children's lower jaw, which is of course smaller than that of the adult, does not evenly fit into the larger jaw of an adult. When viewed from the side, it becomes even more clear. And if the temporomandibular joint area grows more and more backwards with the ramus of the mandible, it means it becomes larger, while the front part has to be reduced. And otherwise, the lower jaw would become more and more massive and more bulky, as we have seen earlier on the blackboard. So what we have to understand is that not only more and more new bone is being built up, no, there are also places where bone is taken away. Bone does not simply grow. It does not simply increase and increase. No, it is remodeled. That's the technical term for it. And these complicated pictures show this in a more spatial context. Let us just take the lower jaw on the right as an example. The gray arrows show apposition of bone, and the red arrows show areas where bone is taken away. In the area of the temporomandibular joint at the back, there is an enormous extension that goes backwards and upwards, and also an increase to the sides. At the same time, we also see red arrows on the inside of the mandibular ramus, which stand for resorption of bone. And as a result, the lower jaw becomes wider in its rear area, but without the ramus becoming too thick. And this way, the V shape of the lower jaw can be maintained during growth. So the mandibular ramus not only moves backwards, but also outwards to the sides. And also at the frontal margin of the ramus, we see a large red arrow also. That stands for cells taking away bone and creating space for the emergence of the posterior teeth. And that compensates for the growth at the very back at the edge of the mandibular ramus. You can apply this principle to the upper jaw and to most of the other bones of the face as well. And this is the basis for the reshaping of the bones as they grow. Bone reacts to forces that are converted into reactions of the cells. And of course, we can use this knowledge for orthodontics and craniofacial orthopedics. However, it is a little more complicated. The orthodontist Franz van der Linden also showed how bone grows at the individual facial sutures. This scheme is already quite complicated when viewed from the side. Actually, the face is a three-dimensional structure that is even more complicated. I do not want to go through it with you in all detail. This is the subject of specialist training for residents in orthodontics. But you can imagine that if these colored parts all grow at different rates, then you can see how it is possible that the face grows at different speeds in different places. And you can also imagine now why all the people look so different with their faces. The individual cranial sutures, the parts marked here, grow differently in each person. And that is why we all look so different, and we can all recognize each other by our faces. And there's something else that has a significant impact on facial growth. I'm talking about the teeth. You can see here with the milk teeth, the face is still rather flat, and it gets a little higher with the emergence of some permanent teeth, and the more teeth are coming, it becomes higher and higher. When the dentition is complete, the face also grows in height, in length, forward, and of course also in width. Now it becomes clear why it is so important for the entire face that the teeth develop correctly. If you put all these processes together, then we can see how the face altogether makes the growth change obliquely forward and down towards the chin. It is different for everyone, and some people grow more vertically and thus have longer faces, and others grow more forward, then they have flatter and wider faces. Your face is probably somewhere in between. Oh, and something else is important. You all may remember that very well yourself. Anyone who has passed puberty knows that we are going through an enormous growth spurt at that time. Suddenly our arms get longer, and so do our legs, and all of a sudden we are sitting higher at the table and have a hunched back, and we watch our skin changing with all these pimples. This all starts to happen with girls when they are 10 years of age, and while boys are a little later, their puberty comes around 12 years of age. This is also the time when our overall interest did change, you know what I mean. And we must make use of this growth spurt in orthodontics and in craniofacial orthopedics if the lower jaw happens to present a lack in growth. More than 50% of our patients have a mandible that is too short due to insufficient growth. Of course, then also the teeth will not interdigitate properly in occlusion, and in the frontal region of the dental arch, the teeth show an increased overjet. But if the whole body grows by 10-20 centimeters in a short time, then you should get another 5 or 7 millimeters for the lower jaw to come forward, mostly with the help of an orthodontic appliance. Of course, when you have to wear them, despite puberty. If you do not wear the recommended appliances, there's a great high risk of damage. If the lower jaw stays too short and the front teeth do not come together properly, it gets worse and worse, as you can see here. The daughter on the left and the mother on the right. The mother was not treated at the appropriate time, and now her lower teeth are biting into the gums behind her upper teeth. There are many methods and orthodontic appliances that can be used to specifically advance growth of the lower jaw. I don't want to commit myself here as to what the best appliance might be, but patients are different and they have their preferences, what they want to wear, and many orthodontists do it their own ways. In addition, there may always be new technical developments in our field, but there is one thing that can hardly be changed: biology. Your body needs to be able to react to the devices, and that takes time. I recommend wearing the appliances 24 hours a day, with a few exceptions, of course. But if you only want to wear them at nights, then you know that it's going back and forth, and in the end, it does not go forward at all. And there are some critics, also among orthodontists, who maintain that such functional orthopedic appliances do not work at all. There are some complicated cases that may not work out well, I know. But anyway, you have to wear the appliances the way it was negotiated with your orthodontist. But when the lower jaw is therapeutically advanced forward, it has taken with it also the teeth, and then they interdigitate in a proper way eventually. Now we see an impressive simulation of the growing skull. We start at 6 months of age and look at the eye sockets as a reference. They always stay at the same size. Now we start school at the age of 6, and you can see that the face is still growing a lot, but particularly in the area below the eyes, that is, the upper and the lower jaw. And now we are soon grown up, you see the typical edges of the lower jaw of a young man. However, did you already know that, although adult, you never stop growing? I mean, the body is constantly changing for biological reasons, and the growth in the face never stops, lifelong. You can see that here in the drawings I made of the young Johann Wolfgang von Goethe, the German poet, after the painting by Daniel Barger. And on the right there is the older Goethe after the painting by Ferdinand Jagermann. Both images are in alignment using the eyebrows as a reference again. You can now see how much the earlobe still grows as one gets older, and the same applies to the tip of the nose. Both are made of cartilage, and it will grow for a lifetime. But also the chin comes significantly further down or forwards in quite a few older individuals. That is then due to the growth of bone. Of course, this has since been investigated in more detail scientifically, for example by Rolf Behrens, also an anatomist and an orthodontist. You can see in the superimposition of the drawings from lateral head films taken at the age of 28 and at the age of 79 on the far right, how much the face has grown in these 50 years. And look again at the tip of the nose, and do you notice how much the chin came down also? We do know this only because people nowadays can keep their own teeth for a life. You can see for yourself how your face changes over time when you take a picture every day, every week, or at least every month. And by the way, how does your smartphone, when you unlock it using face recognition, how does it notice how you change and how you get a little older every day? I don't know how that works. And as far as your teeth and dentition are concerned, your dentist will examine them regularly as a part of the usual prophylactic appointments. And before something grows wrong, your orthodontist should check that too.